We haven't talked much about Ebola lately, but there's a big breakthrough today, and it's thanks to Canadians. Scientists at the National Microbiology Lab in Winnipeg appear to have cracked the code of the deadly Ebola virus. They've developed a vaccine that's showing great promise. It's already saved lives, and as Jennifer Tryon reports, it's the first ray of hope for those on the front lines of the crisis.
6 months ago, and a world away from the worst epidemic of Ebola in history, scientists at Winnipeg's microbiology lab got a big assignment. For the first time, the World Health Organization committed to sponsoring a vaccine. 11,000 lives had already been lost in 3 African countries, and the virus continued to spread. When Canada was called on, its researchers were put under the microscope and now have helped deliver the world's first effective Ebola vaccine.
There were cases. The vaccination arrives 10 days after, no case, flat.
4,000 people were given a dose, half when first exposed to Ebola, the other half after the 21-day incubation period. This could save our life, says this doctor. We're the ones in contact with those who are sick all the time.
The data so far shows that none of the 2,014 persons vaccinated developed Ebola virus disease after 10 days after vaccination.
Canada's job was to identify and isolate the virus to be used in the vaccine, the same study design used in the eradication of polio and smallpox decades ago has proven effective here.
It really is incredible to appreciate the role that Canadian scientists played in the initial concept of this vaccine.
So effective, in fact, the trial was stopped last week so people not enrolled could start getting the shots, even children. This week, there were 7 new cases of Ebola in 3 countries, the lowest 7-day total in over a year.
Had the vaccine been available a year ago at the onset of this outbreak in West Africa, it would have had the potential of saving thousands of lives.
It's too soon to say whether this will be a population-wide vaccine. The plan going forward is to continue to give it to those who have the most contact with the virus, like healthcare workers. But this is the first big breakthrough in protecting a population from a virus that so far has been unstoppable. Donna.
A huge development. Jen Tryon, thank you.